Assistance. In this module, we will look at how to assist an exhausted diver, establish the priorities of our actions, and learn how to deal with and prevent stress. Assisting an exhausted diver on the surface. A rescue, on land and in the water, presents risks and difficulties that must be assessed and dealt with opportunely and competently in order for it to be carried out safely. Before taking any action, ask yourself honestly if you are really capable of dealing with the situation so as to ensure that your rescue attempt doesn't become a second emergency. A cynical but realistic principle of any rescue is, one casualty is better than two. There may be people around you who are better prepared or more qualified to assist in that particular situation. There is no set sequence of actions that are valid for all emergencies. You will have to assess and do what you think is best at that moment. However, some general advice can be given. Before beginning to assist an exhausted diver on the surface, you must make sure that the casualty is not panicking. Approach the diver very carefully so as not to expose yourself to danger, and initially keep at such a distance that the casualty cannot grab hold of you. If the casualty is not in panic, calm them further by explaining to them what they should do, telling them, for example, in a loud, clear voice, jettison your weight belt, inflate your BC, and so on. Pass them some kind of float that they can hold on to for support. If a float is not available, give them clear, simple instructions to inflate their buoyancy compensator and jettison their weights. If the diver is incapable of taking action, you must step in, inflate their BC, and if necessary, jettison their weights. If the sea conditions allow, try to get the diver to relax face upwards in the water and take out their regulator and remove their mask. Encourage the casualty to take deep breaths to prevent or overcome breathlessness. A buoyancy compensator that is inflated too much can constrict the casualty's breathing, so loosen the band around the stomach and the shoulder straps if necessary. While giving assistance, always maintain contact with the casualty and explain what is happening, using encouraging words and gestures. If the casualty recovers physically and mentally, they will be able to swim slowly back to shore or the boat on their own. If this is not the case, you will have to give assistance. In order to conserve energy, it may be best to remove the aqualung. However, the innumerable circumstances are too variable to establish a general rule, so you must assess what is the best thing to do in that particular situation. Always keep in mind the order of priority. Assess if the conditions are safe enough for you to act. Take action so as to never put yourself in danger. Make sure that the diver is not in panic. Try to get the diver to help him or herself. Prevent water getting into the diver's airways. Help the diver to stay buoyant. Encourage the diver to breathe deeply. Transporting an exhausted diver on the surface. There are various ways of transporting an exhausted diver. The fin push method minimizes the hydrodynamic resistance, allows for good visual contact with the casualty, and enables you to see where you are swimming. Some variations to the techniques, such as removing the aqualung, may make transporting the casualty less tiring, but the decision to do so depends on the situation. While transporting a casualty, make sure that their face is out of the water, that they are relaxed, and that they are breathing regularly. Another method of transport is towing the casualty by the cylinder head. This method allows you to fin harder and therefore move quite quickly through the water, but it does not allow you to maintain continuous visual contact with the casualty. While towing, encourage the casualty to relax so they can regain the strength they will need to get out of the water. We can add 2 further points regarding the towing of a casualty to the order of priorities for assisting a diver on the surface. Swim to the shore or boat using the shortest route. Encourage the diver to relax if you are towing them. Exiting from the water with an exhausted diver. On reaching the exit point, assess the situation once again. Also consider the condition of the diver and see if any other help may now be available. If a casualty is particularly exhausted, they will not be able to coordinate their movements or keep their balance. The priorities when exiting are: safety, the least possible effort for everyone involved, speed. When you get near the exit point, explain calmly to the casualty what you want to do. If no other help is available, look for an exit point that presents the minimum risk of falling or injury. The crawling method is limited to the case of a tired diver, but offers the advantage that it can also be applied in rougher sea conditions. Your task as a rescuer is that of staying near the tired diver and providing assistance. This can be done more easily if you also crawl behind them. If the tired diver is able to walk and the sea conditions are good, just support them as you help them onto the shore. With the help of another person, it may be enough to just support them on either side by holding their arms. In either case, if the casualty is very tired, remove their equipment before getting them to stand up. An exhausted diver can be lifted out of the water using the technique known as a chairlift, which involves 2 rescuers. If there is only one rescuer available and the diver is exhausted, things become more complicated, as they have to be moved by sheer force. The back carry technique requires a degree of physical strength, particularly in the legs. More techniques will be explained in other modules. The choice of which one to use depends on the weight of the casualty, the distance you have to cover, and the various difficulties of the exit point. Stress. Any physiological reaction to external stimuli in man that creates a sense of apprehension or uneasiness, conscious or unconscious, is defined as stress. The brain always interprets the sensation of apprehension or uneasiness as an alarm bell and immediately gives the go-ahead to a series of physiological reactions, such as the secretion of catecholamine that serves to stimulate the psychophysical capabilities and increase our level of attention and performance. This is why it is said that a little tension or stress enables you to achieve better results. During a dive, every new stimuli increase the basic level of tension, but stress is not always a positive factor. The danger is that it may cause an avalanche effect, which may lead to the diver losing control of the situation. On crossing this threshold, the ability of analysis declines. Attention is concentrated on just a few elements. The level of performance is reduced, and the probability of making mistakes increases. After making a mistake, whether real or imaginary, the diver may magnify the negative consequences and begin behaving in an irrational manner. Factors of stress. Generally, there are considered to be 2 basic types of stress factors: physical and psychological. The physical factors are real and involve the actual dive. Included in this category are the factors related to the physics of diving, such as the absence of weight, cold, narcosis, poor visibility, loss of dexterity, and so on. There are also those linked to how the dive evolves: a mask that floods continuously, seasickness, waves and currents, limited diving abilities, the sense of the sound being muffled due to wearing a hood, assumption of medication, inadequate nourishment, and such like. The psychological factors may be external, meaning caused by problems unrelated to diving. or maybe concerns about the dive itself. Problems concerning the dive arise when you do not feel prepared for the type of dive planned, are afraid of dangers, feel unsure of what you have to do, or are pressured by more experienced divers. Stress is a cunning enemy. It is not easy to recognize if a diver is suffering from stress, and if they are, to what degree. It is not possible to eliminate stress from diving, but you can learn to recognize and deal with it in yourself and in your dive buddies. Stress shows itself through unusual external behavior or signs, and through internal sensations or symptoms felt by the subject. Signs can be recognized by unusual behavior, frequently touching hair, repeatedly touching some part of the body, biting nails, biting lips, fiddling with something, introversion, irritability and short temper, passive reaction to events, continuous delay in preparation, repeated mistakes with equipment, forgetting a lot of things, attitude that disregards danger, breathes out all at once and almost continuously, wide-eyed with dilated pupils, uncoordinated movements, excessive talkativeness or unjustified hilarity, fixation with equipment problems. Symptoms can only be felt by the subject affected and may be sense of feeling generally unwell, sense of fatigue, headache, cramps, muscular pain, gastrointestinal problems, heartburn, palpitations, tachycardia, increase in blood pressure, insomnia, irritability and short temper, passive reaction to events, forgetfulness and difficulty in expressing oneself, difficulty in completing some tasks, incapable of coordinated action, indecision, closed mind to other solutions, feeling unable to deal with the tasks required, breathlessness. When observing the behavior of the other divers, you have to consider that what may be atypical behavior for one diver may be completely normal for another. The various ways of acting that can be an indication of stress can therefore easily be confused with simple displays of that person's personal character. As well as developing your skills of observation, you must also know how to communicate with others so as to assess the meaning of their suspicious behavior. Dealing with stress. The most effective resource that you have to combat stress is yourself. Careful organization and planning of the dive, training and continuous practice will allow you to positively condition your resistance to stress. You must learn to recognize and accept your limits and only take part in those diving activities that are within your ability. Don't be afraid to say, "I'm not diving," or "I don't want to do that." You just have to take the point of view that nothing is worth as much as your safety, and that diving is just a recreational activity. Diving with a tense buddy can be just as dangerous. Before getting into the water, you must try to reduce your buddy's level of stress. Talk to them calmly and tactfully, and do not make judgments. Show friendly and sincere interest to put them at ease and help them express any concerns they may have. Stress on a dive can quickly turn into panic. It is therefore extremely important to deal with it immediately. The first thing to do is to stop and breathe slowly and deeply. Then think and try to identify the problem and the best way to tackle it. Finally, take action. If the level of stress is not showing signs of decreasing, abort the dive before it is too late. If you notice that your buddy is showing signs of stress, establish physical contact and signal them to stop and breathe normally. Finally, get them to answer the OK signal. If you consider that your buddy is not able to overcome the problem, abort the dive. In the next module, we will examine what anxiety, phobias and panic are, what effect they could have on a diver and how to deal with them. See you soon.